In this video, we will go over a patient assessment, and in this case, it's a trauma. She hurt and fell. First, we want to make sure the scene is safe and be aware of the number of patients there are, and in this case, there is one patient. Next, when we arrive to the patient, we want to consider cervical spine injury and have any bystanders stabilize the head by placing both hands on the head and keeping the spine in place. So if I was in the scene, I would ask someone to place their hands on her head and make sure her spine is straight. And while I am assessing the rest of her, but I don't have a second person, so she's just gonna have to be okay. Then ask the patient if they can hear you. Can you hear me?
Yes, I can hear you.
You want to introduce yourself? Hello, ma'am. My name is Sawyer. Is it okay if I help you?
Yes.
What happened? Do you remember what you were doing when you got injured?
I just fell.
Next, you are going to check the patient's airway and give oxygen if it is necessary. If the patient is conscious, ask them to take a deep breath. Can you take a deep breath for me? Again. When listening, her respiration and depth and rate seem to be normal. Also, you want to check circulation with capillary refill, and while doing that, you want to make sure that her skin is warm, pink, and dry, which all looks good. Next, we are going to do a rapid assessment where I take my hands all down the body and check for any bleeding, and if there is bleeding, then we will go ahead and do a bandage to any injured area. To the head. Doesn't seem to be any blood. Then we need to get the history of the patient. Ask if they are allergic to anything. Ask if they have taken any medications, any medical history that I should know about, and what was the last thing that you ate. Once you get the history, then you go on to assess the patient's orientation by asking if they remember their name, if they know where they are at, and do they know what time it is. Next, you want to take the patient's vitals of blood pressure, and which I don't have a blood pressure cuff right now, but which we would assume right now it's 110/70, and take her pulse, which is 69 beats per minute, and respiration rate, which is 20. Check the patient's pupils. They should be equal and regular size and react to light. If I had a light, I would flash it and flash it. Looks good. Again, check her airway and ask her to breathe deep and listen for any obstructions. Still good. Make sure that she doesn't have any decap BTLS or deformities in the neck or deviated trachea. We're all good there. You want to make sure you measure from ear to clavicle for the cervical collar. We just want to make sure that the collar will fit the patient without causing the pain to the patient. When backboard is available, place the patient on the backboard to keep her body secure. Next, we need to take a physical exam of the patient. We need to check the head for decap BTLS. I just poked her in the eye. The clavicle, the abdomen, the pelvis, the legs, and the feet and the arms for any injury. And then last, contact medical personnel and let them know of the situation, how many patients there are, which is 1, and all the steps taken to assess the patient. While waiting for the medical personnel to arrive, we're going to reassess her vitals every 5 minutes to make sure that the patient is stable.